Everyone, this is Sandy Marrero with Western Marketing. I hope that everyone is okay. Today we have a webinar with Seth Grove, Director of Sales for UnitedHealthOne, and we're going to be talking about their short-term medical and the differences, the different plans that they have available for you guys to work with. Again, Seth, are you there?
I'm here. All right. Well, thanks everyone for jumping on today's call, and just would like to thank all the great folks at Western Marketing for giving me this opportunity to talk about UHOne short-term medical and tri-term medical plans. Really, I'm excited about this call because of just the opportunity. And when I talk about opportunity, I really think there's two opportunities here. First of all is timing. You know, traditionally, a lot of core medical sales are made during the fourth quarter, and then agents are kind of standing around during the first quarter saying, okay, what should I do now? And I'd be saying, hey, you can still sell these short-term and tri-term plans because they don't have to be sold during OEP. But now we're kind of in unprecedented times where we have a special enrollment period where people are again kind of looking at their healthcare options. And so this is just a topic that's up in people's minds. And so it might be an opportunity for you to pick up some additional sales with the short-term and tri-term medical plans. And then also just the value that these plans bring to your clients. When you look at what the benefits that are built into these short-term plans, and you compare the prices of them to other options out there, I truly believe that there's some tremendous value in these plans for your clients where it makes sense, obviously. So we have a lot to get covered today, so we're just going to go ahead and jump in and get started. Obviously, when we look at the individual landscape of health insurance, there's definitely some uncertainty, right? During the Trump administration, he really expanded, what we could do with short-term medical plans. Now with the new administration, they're talking about maybe limiting them. And then also with the new Corona bill, they also increased the subsidies, which obviously hurts the short-term plans. However, right now, there still is a great opportunity for these plans. There's still a lot of people out there that are looking for alternative ways to cover their healthcare needs, and so we're still selling a lot of these short-term plans. And I always say, don't change your habits until you know what's going to happen. So until the administration limits short-term plans, I would say business is as usual, and we're still continuing to have a lot of success selling these plans. And as I mentioned earlier, with the special enrollment period going on, it's another opportunity for people to look at their healthcare options. And so as a result, we're seeing a lot of people still selling a lot of these short-term plans during this special enrollment period as well. So when you look at where short-term plans fall in terms of price points, you can see up on the screen there that obviously the ACA plans are usually going to be the most comprehensive coverage. There's not going to be any underwriting associated with them, and so as a result, those traditionally are going to be the most expensive. And then as you kind of go up the chart there, you can see where the tri-term medical fits and the short-term medical fits. And obviously, they're going to be a less expensive option for your clients. Really, we'll talk about the reasons why they're going to be lower costs, but the big ones are that we'll talk about pre-existing conditions, what's covered, what's not, and then also just some of the benefits in these plans. They're just, the benefits aren't the same, but you're going to see that they are going to include a lot of the core things that your clients are looking for, and it can just be sold as a more cost-effective solution for your clients. But I always like to throw this slide up there so that you can kind of see what we're talking about from a price point in terms of what these short-term and tri-term medical plans cost in relationship to other plans out in the marketplace. The other thing that I like to show people is that these plans can actually be sold year-round. Obviously, we do still get that spike in November and December just because traditionally that's when people are looking at their healthcare options. However, we're pretty consistent in sales throughout the entire year. And obviously, the reason for that is because they don't need a qualifying event to purchase these plans. They don't have to follow open enrollment guidelines. They can purchase them throughout any time of the year. And as a result, this is a product that you can continue to sell even when months start to slow down with other products that you're out there selling. But if you're not familiar with what short-term plans are, basically it's going to be insurance that a client can purchase for a shorter term, and that shorter term is going to be anywhere from 1 month to just shy of a full year. And as I mentioned, you're going to see some similarities and some differences to other core medical plans out there. You know, the biggest thing that I always tell people to remember is that these do not qualify for minimum essential coverage, and they're not ACA plans. They're not for everyone. I also tell people that. They're not going to be for all of your clients, but we'll kind of show you what clients it makes sense for, so that when you come across the particular situations, you'll be sure to be able to offer the short-term medical plans. Up on the screen there, you can see kind of the state coverage. Well, we're going to talk about two short-term plans today, the Gen 5 and the Gen 6. You can see that any of the green states up there actually still have both plans available. The reason that both plans are available in quite a few states is just because some agents like the Gen 5 and some agents like the Gen 6. And so we'll kind of talk about the pros and cons of both of them, but you can kind of see up there what plans are going to be approved in your state. And actually, I think there's a new generation coming out again before OEP this year, and so that will be available in a handful of states here shortly as well. But really up on the screen here is going to be who can benefit from short-term plans, or better I guess is who's going to be your prospects, right? So first of all, I say anyone looking for individual affordable healthcare option, this is going to be an option for them, right? It's just going to be lower costs. And if you're relatively healthy, don't go to the doctor a lot, don't have any pre-existing conditions, this might be an option for you. Also, it's a great fit for the unemployed. A year ago when companies started laying off people, when the pandemic hit and people were working from home, a lot of people lost their job and their healthcare coverage, and they needed something to kind of bridge that gap. Short-term medical plan is always good for people that are unemployed and don't have health care. Also, it's good for clients in between jobs or within a waiting period. And I always use myself as an example. When I switched jobs and came over to UHOne, I actually I started in March of the year, and I didn't have coverage until I think June 1st. And so there was a short-term gap there. And the short-term medical plans is a good option, because if you don't have any health conditions, but you still want some protection, it's going to be a much more affordable solution than purchasing the current plan through Cobra. I think my Cobra option through my previous employer was $500 a month, and with the short-term medical plan, I could get coverage to kind of bridge that gap for less than 200. So just a more affordable option than paying the high cost of Cobra. Self-employed people like short-term medical, as well as seasonal workers. We also see a lot of this as a bridge to the ACA open enrollment. Now we are in a special enrollment period, but normally people wouldn't be able to purchase an ACA plan until next open enrollment unless they had a qualifying event. And so sometimes you just need that bridge to get you to that open enrollment. This would be a good solution for that. Also, trailing spouses in the senior market. I know that Western Marketing does a lot in that over 65 market, and sometimes spouses aren't going to be the same age. So maybe you have one spouse that turns 65 and the other, and that older spouse had insurance through their employer, which they're now losing because they're going on Medicare. Well, now we can get this plan to kind of get that spouse up until they qualify for Medicare as well. Also, students and recent grads. A little history about me is, I graduated from college, went out and worked for a couple years, and then I actually went back to college to be a GA and coach wrestling for a couple years. And obviously I lost my health insurance. And during that time, I actually purchased a short-term medical plan, because again, I looked at what a traditional AC, or at that time it wasn't ACA, but what a traditional health insurance plan costs for an individual, and I just couldn't afford it. And so I went with the short-term plan because I didn't have any pre-existing conditions, and it just made a lot of sense. And then finally, also individuals without citizenship. The only question on the application is if they've been in the United States for at least 12 months. The only citizenship question is if they've been in the U.S. for at least 12 months. So as long as they've been on U.S. soil for 12 months, they're going to qualify for this plan, which is going to be nice. The important caveat to short-term medical plans, and we're talking about Gen 5 and Gen 6 here, pre-existing conditions will not be covered, nor any claims for treatment related thereto. And it's funny, I always get say pre-existing conditions aren't covered, and then they go, then I always get what if scenarios, and I can't make it any clearer that pre-existing conditions aren't covered. So if you're on medication, that's a pre-existing condition, right? It's not going to be covered. Anything that you've been treated for or diagnosed, most states are going to have a 2-year look back period. Some states only have a 1-year look back period, but if it's a pre-existing condition, it's not going to be covered, period. And I can't simplify that anymore. Don't come to me with what if scenarios, because it's just not going to be covered. So just keep that in mind. And I always tell people, if somebody has some underlying health conditions, short-term medical probably isn't going to be the best fit for them, because whatever their underlying condition is, it's not going to be covered. When we're looking at these plans, we kind of hit on this earlier. Remember, this isn't minimum essential coverage. Also, it's going to be underwritten, okay? And so that's why there's going to be a lower cost. With ACA plans, they're guaranteed issue. There's benefits built into it that are required. These don't meet the minimum essential coverage guidelines, and they're going to be underwritten. So again, just keep that in mind. And it's just important to know the differences between the two so that you're explaining them appropriately to your clients. Probably the number one thing that people like about UHOne's short-term medical plans is that they get access to the UnitedHealthcare Choice and Choice Plus network. And we'll talk about the differences between those two on the next slide. But this is a huge network across the United States. People are familiar with it. You can see that a lot of people take UnitedHealthcare insurance. There's over 1.2 million healthcare professionals that take it. There's over 6,500 hospitals, which I guess equates out to 85% of hospitals nationwide. And there's going to be some significant discounts because of the reason that UnitedHealthcare is so big. They're negotiating these rates for the clients. And so if you go in network, you're going to get some huge discounts as well. And so when I talk about this plan, and what, in my opinion, is probably one of the best advantages of going with a short-term plan over one of our competitors that offer short-term plans, is the network. Okay. It's extensive. They're going to get some huge discounts. People are familiar with it. The name of UnitedHealthcare. And so it's just a good plan all around for everyone involved. So as I mentioned, depending on the state that you're selling in, there's going to be 2 networks that are going to be available depending on the state, okay? And so I just tell people, go out, look at the product approval grid, and it's going to tell you the which network your client's going to have access to in their particular state. And candidly, it's about 50-50 as far as which one your state is going to fall into. But the EPO, the Choice Network, is an EPO. That's an exclusive provider organization, and they need to go in network unless it's an emergency, okay? So with an EPO, there's no benefits for non-emergency care. If they get in a car accident, for example, and they just take them to some hospital because they're in an accident and life-threatening condition, it's going to pay. But if you just you're for something else, you need to go into network, okay? But obviously from the previous slide, there's plenty of hospitals and medical providers out there, so that shouldn't really be an issue. The Choice Plus is what's going to be called a preferred provider organization, and again, highly recommended that you do go to an in-network provider. However, the Choice Plus does have some out-of-network benefits as well, but it's just going to be paid at a lower percentage. So again, Choice Plus, yeah, it does have some out-of-network benefits, but I always recommend going in-network whenever possible because it's going to be paid out at a higher percentage. And you get those pre-negotiated rates. So when we take a look at these plans, short-term medical, as I mentioned, we're going to have Gen 5 and Gen 6. Up on the screen there, you can see what the names of the Gen 5s are, and we'll go through, what's covered and what's not on these plans. Just know that, as you kind of go up, also does the cost, but so does the coverage for these plans as well. But taking a kind of look at the product grid here, the value select A is going to be the least expensive. Basically, when we look at these plans, you're going to be able to select anywhere from 30 to 360 days. Okay. I can tell you that the 2 most popular deductibles on these plans are going to be $5,000 and $12,500. So again, people's kind of purchasing these just as a just in case. But basically how it works is that you select the length of time, so anywhere from 30 to 360 days. Then you choose your deductible. You can do 1,000, 2,500, 5,000, 10,000, 12,500. And then depending on the plan that you select, whether it's a value select or a plus select or a plus elite, you're going to choose your co-insurance. With the plus elite A, there actually is no co-insurance. Once you hit the deductible, you're going to be covered at 100%. Otherwise, if you choose either the value select or the plus select A, you would choose the co-insurance, and then you would actually have co-insurance out-of-pocket maximum after the deductible is hit. And you can see that with the value select A, you either can do 5,000 or 10,000. And with the plus select A, you can do 2, 5, or 10,000. So the point of that is you do have a lot of flexibility on these plans. So you can, adjust deductible co-insurance amounts in order to make sure that it is going to be affordable for the client. With these particular plans, doctor office visits are just going to be subject to the co-insurance and deductible. We'll talk about a plan on the Gen 6 that if they are looking for some co-pays, they're better off looking at the Gen 6 plan. However, going to an urgent care has a $75 copay, and so the kids aren't feeling well, and you just want to take them to go see a doctor. It's only going to be a $75 copay at that urgent care, assuming that it's going to be in network. Other than that, your outpatient and inpatient hospital services are going to be subject to the copay. And then with your pharmacy benefits, with this lowest cost, there's not going to be any prescription coverage. It's a discount only. And then with your plus select A and your plus elite A, there is going to be that preferred price card and then co-insurance after the deductible. But it is going to be capped at $3,000 max for the prescription drugs with these short-term plans. But the biggest thing also to remember is that pre-existing conditions aren't covered, and so if they are on a medication, it's not going to be covered with these plans. One of the nice things about the Gen 5 plans is that you can actually prepay for the entire length of the plan. And so if they do that, a lot of times you're going to see some significant savings. And the nice thing about it is that if you don't use the premium, so let's say I say, well, I think I need this for 6 months, but it turns out you only need it 3. First of all, you're going to get some huge savings by prepaying it all up front, but then you're also going to get a return of unused premium. And since this is based on a daily basis, you actually get it up to the cancellation date, where you're going to see on the Gen 5, it's actually, you only can cancel it to the paid to date. And so we'll kind of talk about the differences between that. But with this plan, again, you can pay a lump sum and get some huge savings. And if for some reason you don't use the coverage, you can get a return of premium, which is going to be nice. So now we're going to take a look at the Gen 6 plans. Remember, some states have both available, and we'll kind of talk about the pros and cons between the two. But you can see the different plans available, and from a pricing standpoint, they kind of go left to right there with the value, plus elite, and copay. The plus elite, you can see that one of the nice things about it is that we're going to start seeing some prescription copays. And so with that, there's only a 25% copay for any tier 1 drugs. And then also with that plus elite, there is still that $75 urgent care visit, which is nice. The plus elite, again, you choose your deductible, and then there is no co-insurance after that. And so if you just want to pay your deductible and be done, plus elite's going to be the plan that you want to look at. Now, if your client is looking for some doctor office visit copays, the Gen 6 plan is the one you're going to want to take a look at, because you can see now, in addition to the $75 urgent care visit copay, there's also a $75 doctor office visit copay. And so that's going to be nice. After that, you choose your deductible, and then you're going to have 20% co-insurance up to either $5,000 or $10,000 of your maximum out of pocket after that deductible is paid. So again, if they're looking for that copay for doctor's office visits, the copay plan in Gen 6 is going to be the one that you want to take a look at. The plus and value plans, you can kind of take a look up there as what's going to be covered. Plus, the biggest difference is that the doctor's office copays aren't going to be covered. After you hit the deductible, you're going to be 20% up to those out-of-pocket maximums. And then, with your value plan, this is going to be the least expensive plan that you can buy on the Gen 6. Again, $75 urgent care visits, which is nice. Choose your deductible, and then it's going to be 30% coinsurance up to either $5,000 or $10,000. Also, I need to point out that it's only going to cover inpatient prescriptions on this plan, and so be advised of that when you're talking with your clients. But really, when you're looking at the differences between the two, here's the deal. The Gen 6 is going to be based on months, where your Gen 5 is going to be based on days. The Gen 6 does have some 2x12 plans available, which means that they can automatically enroll in 2 basically year-long plans in some states. The Gen 5 does have a $20 application fee. But the Gen 5 also has that lump sum option that will pay for might receive a 24% discount, which is going to be nice. As far as cancellation, if you cancel your Gen 6, it's going to be canceled as at the paid to date, where if you cancel your Gen 5, you get reimbursement up to the day you cancel it. The waiting period, Gen 6 doesn't have any waiting period. The Gen 5 does have a 5-day wait period for illness, but obviously accidents would be covered at day 1. Gen 6 has a little bit higher benefits when you start looking at air ambulance, outpatient spine and back benefits, and also I think that they have a little bit better prescription coverage on the Gen 6, and they also have a higher maximum amount of $5,000 versus $3,000 with the Gen 5. So the point of that is that which one should you sell? I always say it depends. Generally speaking, your Gen 6 is going to be a little bit more expensive, but I think it has a little bit better benefits built into the plan. So, so take a look at it. I tell people that the best comparison tool there is out there is, the actual quote tool, which unfortunately you can't actually compare a Gen 6 and a Gen 5 side by side, but you can compare the different Gen 6 plan side by side, or all the Gen 5 plans side by side. And so you can kind of start playing with deductibles, looking at the different plans, and then aligning the best plan for your client depending on what their specific needs are. But this is a real valuable tool. I use it all the time, especially when people say, well, which one should I be selling? And then I can kind of go through the difference and then let the client decide which one's going to be the best for them. As far as eligibility guidelines, issue ages 19 to 64 and 11 months, dependents up to age 26. U.S. residents only have to be here on the U.S. soil for 12 consecutive months, and we're going to talk about what the simplified underwriting means. First of all, the first part of the underwriting with these short-term plans are going to be the application. I always tell people, look at the look back period on these questions, and then also, don't get confused with some of these questions. Like here, it says excluding high blood pressure. And just read through the questions, and you can really tell if they're going to qualify or not for the plan. After that, it is subject to a height weight table. This is kind of a yes or no, and so they need to make sure that they're in the height weight, or else they're not going to qualify for this plan. And then finally, the third phase is that we actually hit a database of claims within UnitedHealthcare. So obviously this is we have a lot of members, whether it's through individual plans or through group plans. And so we just hit that database, see if there's any major claims that they're not answering truthfully on the application. And if for some reason they are declined, they can appeal the decision, but they're going to have to submit 5 years of medical records. And I always go back and kind of re-hit on this. In my opinion, your short-term plans are for your healthy people anyways. If they have pre-existing conditions, it's probably not one of the better options for them. But if for some reason they do get declined, they do have the ability to appeal it. The next plan that I want to talk about is SureBridge's Tri-Term medical plan. And this is kind of a different variation of short-term medical plans in that you actually can have coverage for just shy of 3 years. And so it's 1 day shy of 3 years. You can have coverage where, with the short-term plans, you're anywhere from 1 to 12 months. Now the Gen 6 does have a couple 2x12 plans where you can extend that coverage for another year, but this is going to be a way for your client to get 3 or just shy of 3 years, and with no additional underwriting. And then they'll also see that a lot of the benefits that they're looking for are going to be in this plan as well. And so, when you look at some of the better alternatives to ACA coverages out there, this is going to be one of the better ones, just because, again, you can extend it, past that 1 year. We're going to look at pre-X's, and actually with this plan, pre-X's will be covered after 12 months. There's going to be a better drug card built into this, or not drug card, but prescription benefits. So we're going to talk about how, tier 1, tier 2, tier 3, tier 4 would be paid. This also includes some preventative benefits, which are nice. We're going to get access to the same networks that we talked about with the Gen 5 and Gen 6. And then it's really just usually kind of that price point in between short-term plans and ACA plans. And so again, it's just giving your clients another option in terms of pricing. The most popular plan that we sell on this short-term plan is going to be the Copay Select Max. And I think that the reason is that people just like the way it's designed. They like the copays, built into it, and it's the plan that we sell the most of, Copay Select Max. So if you look at it, you select your deductible. Remember, this is going to be 3 terms, so just shy of 3 years. But you select your deductible, then you're going to be at 30% co-insurance. Your out-of-pocket maximum after the deductible is $4,500, and then $2 million of coverage, which is going to be good. Medical benefits, your doctor's office visits, $50 copay for the first 4 visits. Urgent care still has that unlimited $75 copay. Preventative care only has $50 copay. Do take a look at that to see what's covered and what's not. And then, you're looking at, for your other benefits, ER, inpatient services, things of that nature, 30% after the deductible up to your maximum out of pocket of $4,500. Your prescription tier drugs or prescription coverage up to $5,000 of benefit there. Tier 1 just has that $25 copay. For your tiers 2, 3, and 4, it is subject to a $500 RX prescription deductible. But then you can see what the copays are after that. And so again, Copay Select is going to be our number 1 selling plan, tri-term plan. But there's other plans available. When you look at the plan 80, you select your deductible, and then basically you're going to be subject to 20% co-insurance up to that $2,000 of out-of-pocket maximum. And that's going to include, it's going to work similar with your outpatient drugs for that one as well. You got to hit your deductible, hit your out of pocket, and then that would kick in. The plan 100 max, that's the one where you select the deductible and then you don't have any additional co-insurance. It's just pay your deductible and then you're going to be covered. The value is going to have some things carved out of it. The biggest one is that there is no prescription coverage with the value. So that's going to be a less expensive option. Also, preventative benefits aren't covered either. So again, just kind of the value is going to be a lower cost. And in addition to the value being lower cost, there's actually one called surgery and hospital and surgery plan, and this actually has a lot of the benefits excluded from it as well. But this is going to be the bare bones where you just want to make sure you have some coverage if you have to go to be in the hospital. Still does have the $75 copays, but it is limited to 2 visits where the other ones are not. But this is, again, plenty of options out there, so you can kind of play around with the different plans, the different deductibles, co-insurance, and you're probably going to be able to find a plan that fits into your client's budget. Biggest thing to remember, again, not ACA coverage, okay, but as you saw, especially with that Copay Select, a lot of the same benefits that your client's looking for. It's one application, and then you're getting coverage for just shy of 36 months, okay? So keep that in mind. The cost does increase with age, so be advised with that. But they get that coverage for 3 years, which is going to be nice. Pre-existing conditions covered after the first 12 months. It says their pre-X may be covered. The only reason it wouldn't be would be, if they lied on the application about an existing condition, that would have knocked them out. But otherwise, they're going to be covered, for those pre-X after the 12 months. These plans are subject in some states for the client enrolling into the Federation of American Consumer and Travelers And it's just that we had to have it tied to an association in order to get these approved in some states. Again, it's about 50-50 as far as which states require this and which ones don't. And just check your product guide or your product approval grid to see if they do have to enroll in this. Now, the good news is that the $4 a month is just baked into the premium, so it's not any additional cost on top of it. However, it is built into the premium. But the good thing is that in the states where they're required to enroll in this, they actually get some pretty good benefits. You can see there's some accidental death benefit, travel discounts, retail discounts. And so if you actually use some of these, you're going to definitely recoup that $4 cost. But be advised with that, because your client's going to start receiving information on them once they enroll, and they might be saying, what the heck's going on here? But again, it's built into the premium, and so when you quote it, it's going to be included in the price. But just be advised of it, because again, your clients will start receiving information on it. So from an underwriting perspective, what I do tell people is that there is some differences between the Gen 5 and Gen 6 short-term plans. The bill chart is a big difference. We are having to cover this for 3 years, and so it's not quite as liberal as the short-term plans. I recommend taking a look at the actual apps and looking at the questions, because there are going to be some differences. And then with the tri-term, we actually have the ability to rate up or decline as well. And so, like, rate up for tobacco, for example. Underwriting is just going to be more detailed because obviously pre-X's are covered after the initial term, and so it's a little bit tougher, but it's not hard. But just be advised that it is a little bit different than the Gen 6 plans. Otherwise, it's going to be a great option for your client, especially if they're looking for something with that extended care, shooting out to 3 years there. So that's the short-term plan. And the last thing I want to just kind of hit on real quick are the dental plans. Sandy asked me to cover the UHOne dental plans, which with your UHOne contract, you get access to these individual plans as well. And it's nice because, again, especially if you're selling the short-term plans, just because you get that good brand name with UnitedHealthcare, and actually access to the entire network as well. And so, with these plans, they were revamped relatively recently with the Gen 3 of the dental plans. But we're going to talk about the DVH coverage. And so if you're not familiar with DVH, it's dental, vision, hearing coverage. And so, you're going to get some, if they want some vision benefits, they can, add it on as a rider. And then we'll talk about the hearing benefits that are actually built in. Some plans don't have waiting periods. There's a lot of plans, and I'll kind of hit on the highlights of all the plans, but some plans don't have waiting periods. We have up to $3,000 annual maximum. So, I think the lowest is $1,000, and there's a $1,500, $2,000, even $3,000. There's going to be some orthodontics covered on one plan. Also, dental implants are covered on one plan. So I always say when I'm giving, presentations on, dental insurance, those are the two questions that always come up. And we have plans that have coverage built into them for that. And then also we got some good out-of-network coverage built into these plans than the old United plans that were out there. But these plans are going to be sold as standalone. So you can, market it to all your customers, regardless as if they have health insurance. So they don't have to have a UHO or a UHOne short-term plan to get these. You can market it to everyone. The primary insured does have to be 18. So there is no child only. There's no maximum age limit. We can't have a next day effective date. They're not going to be medically underwritten. So they're, once they get them in force, which they'll get them in force, and then they're going to be guaranteed renewable after that. As far as, pricing is concerned, there is going to be individual pricing. There's individual and spouse pricing, and there's also individual children and then family pricing. And the biggest thing to remember here is that the individual and children and then the family tiers, the price is the same regardless of the number of children covered. So a lot of other dental plans out there, you don't get a family rate. You only get to pay individual rates. And so if you got 5 kids, you got to pay 5 individual rates. Where with this plan, you just pay the family rates regardless of the number of kids that you have. There's going to be 3 different plan types, and then what we call 2 distinct customer segments. Basically, if they're under 64, so 18 to 64, they're either going to go with primary or premier. And then if they're over 64, they have to go with the gen option. There is that 1 year of overlap. So keep that in mind. You do have a little bit of flexibility there. Spouses can be covered regardless of age. And so, if you have one spouse over or under a particular cutoff, they're still going to be able to be added and covered on that plan. So you can kind of take a look at it and see which way is the best to go in those types of scenarios. But looking at the primary plans, these are going to be the least expensive, and we'll kind of take a look at what is covered and where with these particular plans. $50 deductible that needs to be played with these plans, and then you can kind of look at what the percentages are going to be covered at. Your primary and primary plus, the biggest thing I always like to point out is that your major services aren't going to be covered. Okay, so this is just going to be your preventative and your basic. So basically, go get your teeth cleaned, and a simple filling or even a simple extraction is going to be covered. And you can see what the percentages are on that, where it's 50% day one for your basic services, and then jumps up year 2 and year 3, 65 and 80% accordingly. With your primary preferred and primary preferred plus, that does have some major type services. However, there is going to be a 6-month wait on those, and then it's only going to be covered at 15% for the remainder of the year, then jump up to 50, and then 60% year 3. And so these are going to be the lowest cost plans that are out there. And you can see the primary, if you want the least expensive, the primary is the way to go. Otherwise you can look at the other plans, but all these plans have $1,000 annual maximum plan. Now the premier type plans, these are going to get a little bit more expensive, but you can see that they're going to have just better, or not better, but they're just going to have more comprehensive benefits than the other plans that we just discussed. And so taking a look at these, still $50 deductible on these plans. Now you're seeing higher maximum amounts, and so you can see that the Premier Choice $1,500, Premier Elite jumps up to $2,000, Premier Plus $2,000, and then if you want that $3,000 annual maximum, you can look at the Premier Max, which is going to be the highest maximum amount that we have. Preventative covered 100% day one. Basic services, it just depends. You can see that when we go up to the Premier Max, it does have that 4-month waiting period. Otherwise, with the Premier and Premier Elite, it starts off with 50% the first year, and then the Premier Plus is only at 35% for those basic type services. With the major type services, some of them have immediate benefits, but when you look at the immediate benefits, it actually has lower payouts on it. So if you need major services like a crown or root canal, they are covered from day one, but they're only covered at 10%, and then it jumps to 40 and 50% years 2 and 3. When we talk about orthodontic services and implants, and everybody always asks me, do they cover orthodontics or dental implants? The Premier Plus does, okay? And so if you're those are things you're concerned about, you can take a look at the Premier Plus. There is that 12-month wait on on the orthodontic services. Your implants would actually be covered day one, but only at 10%. But if you're looking for those types of plans, they're going to be available for your client. The Gen plans for those individuals 64 and over, you're going to have 4 options also, and we'll kind of look at the differences between these plans. The Gen Saver and Gen Saver Plus do have a little bit higher deductible at $100. As far as benefit amounts you can choose from, you either can do $1,000 for the Gen Saver and Gen Saver Plus, $1,500 for the basic, and then $2,000 for the Gen Deluxe. Preventative services, they are covered at day one, but some of the plans are only at 60%, where the Gen Basic is 100% day one. Your basic services, again, are covered from day one at 50%, then 65%, and then 80% year 3s and beyond. Major services, you can see are going to be covered day one as well, just at that lower 10% amount. And again, if you want one that does have dental implant coverage, the Gen Deluxe does, where the other ones do not. So you can kind of take a look at them and see what the most valuable feature is on these plans, and then like I say, go out and quote them, put them side by side, and then you can kind of decide which one's going to be the best for your clients in those particular situations. As I mentioned earlier, there's also vision and hearing benefits built into these plans. Well, I shouldn't say that. Vision will actually be a rider, so there'll be an additional cost for the vision benefit, but the hearing benefit is including in these plans for both over and under 65. And we'll kind of talk about the extent of these, but also remember that these benefits don't have any medical underwritings either. The annual maximums are completely separate from one another. So what I mean by that is that these benefits are in addition to the maximum benefits listed on the previous slide. So if they have a $1,000 dental maximum, they get $1,000 for the dental, and then these are actually going to be in addition. And when you look at it, and just the fact that we don't have a bucket for these benefits, it's going to be a pretty good benefit for your clients. So if they're on the under 64 markets, they are going to get glasses and contacts. If they're in Gen, they're the older 64, they're going to have to do glasses or contacts. But really, the way that the vision works on this is that they get the eye exam once every 12 months. They go in network, there's a $10 copay. If they go out of network, there's only going to be a $50 allowance, but they can go get those eyes checks. These benefits are going to be available immediately. Eyeglasses or eyeglass frames are also going to be covered every 12 months. In network, the customer is going to be responsible for any charge over the $150 allowance. So there's a $150 allowance for in network. Non-network providers, there's only going to be that $75 allowance. Lenses are also going to be covered every 12 months. In network, the customer will only have a $10 copay. Non-network, your customer's responsibility will vary depending on the type of lens. Basically, they're going to be responsible for any charge over $40 for a single, $60 for bifocal, and $80 for the trifocals. Contacts are also going to be covered, and you can see up there that some contacts are that if they're on the select contacts lens list, it's going to have $0 copay. If they're not on that particular list, it is going to be $150 allowance for those. So pretty good vision benefits that are going to be available immediately on these plans. With the hearing benefits, again, these are going to include the appointment setting with the audiologist. They're going to get some great discounts on the hearing exams and hearing aids, and then there's also some other pretty good benefits as well. So you can see there's a 45-day trial period for hearing aids, complimentary 1-year supply of batteries. But the Epic Hearing Healthcare network, you can see some of the benefits there, but basically they're getting $75 for the eye exam, and then hearing aid, you can see what they get after the particular year. So if they wait for 3 years to get any benefits, they basically get $750 towards the hearing aids. If they have to buy them in between, it just depends on how long they have waited for since they had hearing aids. So great option on that. That's a pretty good benefit for $750 after year 3. Otherwise it would be lower amounts, and we do know that hearing aids can be pretty expensive, but you're looking at some pretty significant discounts of 30 to 60% off of retail on major hearing aid brands. So good benefits for the dental, vision, and hearing. Especially if you're working in that over 65 market, taking a look at the Gen plans, and great for those people that are looking for those types of benefits. So with that, I know we threw a lot of information at you. There's a lot of different moving parts depending on the plan that you're looking at, but my advice is just to dive in. The best tool that you can use to learn these plans is to go out, reach out to Sandy at Western Marketing, get contracted with UHOne. Once you get your contract in force, go out, look at the quoting tool, and just start quoting them side by side. The quoting tool does a great job of laying out a highlight of what's covered and at what percentages, and then you can see what the cost is, and it will really help you hone in on what plans you should be selling. So with that, Sandy, I'll turn it back over to you, and we can go from there.
Well, thank you very much, Seth. I appreciate it. A great job at presenting the opportunities with United Healthcare. like you said, the best way to do this business is to just jump in and do some quotes. We will be able to get everybody set up. Contracting is fairly simple. We sent an email contracting link that you can put yourself on the system. It is required when we send the contracting for everyone to just put their NPN number. If I have an NPN number, an email address, and last name and first name, and we'll be able to send that contracting link. If you do have a contract already and having been using UnitedHealthOne for a while, we need to or require a transfer form or release form as required by the company. But this is a great opportunity for you guys to jump in and make sure that you can take advantage of this great company that and with such a large network. So thank you very much for participating. Thank you, Seth, for giving us the opportunity to have a partnership with you. And I hope to see you soon on our system and get you contracting. I will send copies of this webinar to everyone that was on the webinar and some information on where the policies are available in what state. Have a great day. Thank you.